Welcome to Nitric Oxide, the key to sexual health and cardiovascular fitness. This is Dr. Judson Brandeis, Chief Medical Officer of Affirm Science and Director of Quality Excellence for Gainswave. I am a board-certified urologist with an expertise in sexual medicine. The purpose of this webinar is to discuss what happens in the body to cause erectile dysfunction or ED, and how nitric oxide improves sexual function. Men know about Cialis and Viagra and the TV commercials for these medications targeted towards men with erectile dysfunction. Most men do not know that nitric oxide research played a critical role in the development of this class of medications. The importance of nitric oxide goes well beyond male sexual function. Erectile dysfunction can be a warning sign for underlying cardiovascular disease. This webinar is approximately 20 minutes in length with 27 slides. It does include technical and scientific details, so let's get started. Erectile dysfunction, ED, or the inability to achieve and maintain an erect penis for sexual function, can lead to performance anxiety, a negative impact on self-esteem and personal relationships, and even clinical depression. For many men, the inability to perform adequately during sex directly affects their feelings of overall confidence. If you are a male over the age of 40 and you have gone to your doctor for an annual checkup, your physician may have asked you if you are having problems maintaining an erection. The reason for this question has little to do with poor sexual function. Instead, your physician is asking you this question because erectile dysfunction can be an early warning sign for diabetes and/or circulatory problems. You might be wondering what diabetes and heart issues have to do with erections. The story starts with a small molecule called nitric oxide, which in this case is a signaling molecule. What this means is that it causes something else to occur, and without it, the event cannot take place. For men, nitric oxide is absolutely necessary for an erection. Without nitric oxide, there'll be no erection. With reduced nitric oxide production, you'll have a weak erection. Proper nitric oxide production helps you maintain proper sexual function. Now let's take a look at a review article from the Journal of Geriatric Cardiology on nitric oxide. As you can see from the graph, as you age, your body's production of nitric oxide declines. In the average man, by the time they're 45, their nitric oxide production has decreased 50% of normal. And by the time they're 70, their nitric oxide production is below 20%. Even with good diet and exercise, by age 70, most men are well below 50%. Think of this like a dimmer switch. If the light in the room is at 30%, you might be able to walk around, but you won't be able to speed read or do surgery. From a vascular perspective, your normal blood pressure is 120/80, but during an erection, the blood pressure in the penis reaches 300 or more. Now let's look at the next part of the story. You might be thinking of the obvious organ that is most closely associated with male performance in the bedroom. Well, we're going to introduce you to another organ that most people have never heard of, but it is critical to sexual function. It's called the endothelium. It's the